Hi, I'm Meshal Malik, and you're watching Indus Special. Artificial intelligence. A lot of buzz about this technology. For some, it's the future we must invest in, while for others, it's a future we must fear. So how should we look and understand AI? On the show today, that is our discussion. Let me welcome our guests for the conversation today, Mr. Stuart McNish, who's a journalist and the host of Conversations That Matter, an affiliate program of Simon Fraser University in Vancouver. He joins us from Vancouver. Also joining us today is Mr. Jay Tuck, who's a defense analyst and author of High-Tech Espionage and the latest book, Evolution Without Us. He joins us from Hamburg. Thank you both for joining us, and a very, very warm welcome to the show. Stuart, I'd like to begin with you, and let's start by separating science fiction from reality and understand where artificial intelligence stands today. How advanced is it exactly?
Everything comes down to what you talk about by artificial intelligence. Are we talking humanoid artificial intelligence? Or are we talking machine learning? And even at the machine learning stage, we're still at pretty early days. You know, there's a couple of functions that artificial intelligence has to do to truly start to mimic what we as humans can do. Can we label, or can we create an image based on a description? Computers are starting to be able to do that. Where we're seeing, especially outside of espionage circles and so on, artificial intelligence really coming into play is the way that programs have been designed to crunch big data. And in doing so, they're starting to create models of you and I about what we do, where we're going, what we might do next, and then how are we going to then use that information and put it in front of you the next time you click onto some social media site or go to a news site and so on. And the big concern from my perspective and those people that I've talked to about this issue is, what's the motivation behind the programming that was designed to be able to take that information, and then is it going to be used in a benevolent way or malevolent way? And these are the questions that have to be asked. What's the purpose? What's the motivation?
So as you point this out here yourself, the questions that are posed to you and the questions you yourself have as a journalist, what's the motivation for all of this? How will it be used? There is so much growing fear related to AI, and I want to get your take on this. As you say, machine learning, we're early on into those stages. We're not quite there yet where robots are going to take over the world. Why is it that so much concern and so much fear of AI exists?
Why is there so much fear? Because we don't know what the motivation of those programmers is. Are they going to use it for benevolent or malevolent means? You can take a look at what happens on social media and the distribution of misinformation, or the way in which machine learning starts to identify different posts and says, this doesn't fit within our guidelines. It's based on some algorithm, yet it may be relevant material. One of the perfect examples around that is we took a look at a number of videos on YouTube, hundreds of thousands, I understand, that were taken down about the atrocities that were happening in Syria when there was the fleeing of refugees. That was driven by algorithms that took down what may have been vital information that would give us appropriate insights into what was happening to those poor people who had to flee for their lives. And their plight was not being recorded or shared in a manner that would allow people to make fully informed decisions. And so It was machine learning with a particular purpose that said, this is what the outcome will be. And that's just a small example. What happens when now we start using face recognition to say that
Stuart, I'm just going to hold you to that point over here, because I want to come back to all the anxieties that are surrounding AI, but I want to go to Jay and talk to him about this, because Jay, you interact with the experts, you interact with the people who are responsible for creating these algorithms, you've interviewed many of them. So what are their concerns? Because we understand that the people whose informations, whose data will be collected, they have a lot of alarm regarding it. But what are the concerns of those who are at the end of actually developing all of this?
Well, first, I think your beginning announcement was very much to the point. We have to separate AI from science fiction. And a lot of people talk about the day when AI will become conscious like we are and will have its own motivations. And AI is a software, and it's made up of cold code. It has no heart, it has no sex, it has no feelings. It simply does its job. The problem is doing its job, which it does by number crunching, massive numbers that are being calculated, is able to do very, very highly skilled jobs. It used to be that machines would take over the functions of the muscle jobs, the sweat jobs. And today it's the highest paid jobs that are being taken over. Take a look at the stock market. When I was working at the TV station ARD, we wanted to have our reporters down on the floor of the stock market, but they wouldn't let us because there were millions and billions of dollars of trading going on down there. Now, you look at the floor of the stock market in New York, in Frankfurt, in Tokyo, anywhere in the world, it's empty because there are hardly any people left there. Why? Because the machines are doing that work. That's the work of highly skilled, highly paid people. The same is true in many branches of medicine. I've been to many of the top hospitals throughout Europe, and the head radiologists say that the computers can do the analysis of an MRT or CT much better than we as humans can. So it's moving now into the highly paid, highly specialized top management jobs that are controlling our society.
Right. Jay, I'm going to hold you and press you to that question I asked you initially, which is when you're talking to the experts in Silicon Valley, when you're interviewing them, do they raise concerns about this technology?
Yes, they do. There are thousands that have signed petitions addressing especially the United Nations, mostly in the field of weaponry, because this AI is becoming independent. Stuart spoke about the
What does that mean? What does that mean? You saying that it's becoming independent? Explain it to our viewers.
Okay. The definition of artificial intelligence is a software that writes itself. It's not like it used to be. A person would sit down and type something into a keyboard, and the computer program would do that. It learns. It learns by its mistakes, and it learns from the data. The more data it has, the better it is at learning. But this learning is autonomous. And in weapons systems, we're talking about taking the kill decision, as to who gets killed and when, away from human beings, and this is the planning of the Pentagon, and turning it over to AI. And there are many, many parts of management now which are being turned over to AI. And these are areas, once you have given up your sovereignty over areas to decide and turn them over to the machines, which are developing themselves independently, you lose control. And that's where it starts to get very dangerous very quickly.
Right. Jay, something that you said here really clicked with me, and I'm going to take this to Stuart. You said that AI doesn't have a heart, it doesn't have a soul, it doesn't have a sex. It's independent from all these factors. So essentially, we're taking out the human elements from it, which also means the human elements that can make jobs perhaps less efficient. We're turning up those a notch, but we're also taking these very essential human elements of feeling, empathy, all these factors away from it. Stuart, when you hear that and you hear these two things being put side to side, the efficiency and then these human elements being divorced from the technology, how do you see it? Do you think this is for the good, or do you think this is more damaging than it is good?
Well, I am reminded of a statement that I heard many, many years ago that said there is no invention that has been created for good that doesn't have an equal and dangerous use for the negative. And so it comes back to, for me, what's the motivation? I interviewed a very interesting fellow by the name of Geordie Rose, who is the mastermind at a company here in Vancouver called Sanctuary AI, and their purpose is to do humanoid artificial intelligence. In other words, artificial intelligence that can do what you and I can, that we can reason our way through any kind of issue that we are right now. So then you have to build in what is the morality. And going back to the question of, are we separating science fiction from reality? How close are we to that? I think we're a long, long way away from it. but it still comes back to motivation. Now, Geordie Rose says, once we get to this point where AI starts to take over the vast majority of jobs, as he says, the real issue is then how does that function within a capitalist society where you go to work, you get paid, the company prospers, everybody benefits. Well, when the company doesn't need you any longer and it's still producing all of these programs, where does all the money go? Does it stay with the company, or do you now have to start to pay an automation or an intelligence tax that is different, and that money has to go back into governments to support people? Where do we go with this? It is such a wide open topic. Are we worried about it? I think we have every right to be worried about it. Should we also be hopeful? Yes, we have to be hopeful because, you know, there was a fabulous architect out of Chicago who said, you have to dare to dream big because small dreams do not stir the blood of one's imagination. So it's move forward, but we have to move forward with caution. Am I concerned? Yes, I am, but I'm also hopeful.
Right. You're concerned, but you're also hopeful. Jay, talking about those concerns, how do governments deal and tackle them? We know that the United States and China are heavily investing in AI. And these concerns of greater unemployment accompanying, you know, greater implementation of AI, do you think that there is a need for a balancing act? How are governments dealing with these questions?
Well, I think you're right. Those are the two leading countries. My book just came out in Chinese this week, by the way.
Congratulations on that.
Yes, thank you. And I'm looking forward to visiting that country. They're doing some very, very amazing AI things. And those two countries are the main players. The rest of people are sort of running with the pack. And governments have a great deal of difficulty. I've traveled a lot around Washington and New York and Brussels and Berlin and other capitals. The people who are on the lawmaker side who are dealing with this issue don't really understand very much about what they're doing. And it's very, very hard to control a technology that is not growing slowly, it's growing exponentially, it's growing explosively, the speed of growth. And it's being implemented into society. When the printing press was invented, when electricity was invented, we had a lot of time as a society to adjust to it. And it's called the resistance. The Luddites, they used to smash the machines because they wanted to. We don't have time anymore. A new innovation comes on the market. There is no FDA, no drug control agency to check our technology to see is this good for us or is it dangerous for us. It just goes right into the cycle, right into without us as a society checking. Do we need it? Do we want it? Is it good for us?
Jay, Todd, the United States and China and the tech war that's already going on, it's intensifying with each day that's come. How will this complicate things further? And I want to talk about the global fallout of that.
Well, the faster the technology goes, the smaller the circle of players is. As I say, there are only really two players right now. And that means that other countries are basically sitting on the audience and watching what is going on. And if the government is not able to really understand what is going on and to control it, it gets very, very scary. It gets out of control. Not like a science fiction monster, not like Terminator, but like a machine that's doing a job and making decisions about our futures, about our lives, not just about our jobs, but about the whole way our society is built. If you look, for example, at the way face recognition in China, it's unthinkable to imagine the Chinese society without face recognition, without the point system. They're distributing points about who is good and who is bad. It's becoming a central part of our society, and most people aren't even realizing that.
Right. Stuart, facial recognition technology, that comes with a set of a lot of biases, a lot of prejudices, something that human rights groups are talking about. They're urging companies not to sell these technologies to governments. There's so much concern surrounding that. How do we separate the good from the bad in this situation, something that seems to be threatening the privacy and perhaps, you know, the basic social freedoms of so many people?
That's a good question because it's very difficult to answer. Number one, when we take a look at facial recognition technology, even if it's 99% accurate, there's still an extraordinary room for error. And that error can rob people of their rights. Just the fact that you're being tracked also does rob you of your rights. Facial recognition technology in the hands of organizations and machines that are not looking at the person is a big concern. And I don't know anybody who has the answer right now.
Right, it seems to be too far out in the future. Jay, do you agree with that there's no answers available for this, how we circumvent so much of the bad and so many of the dangers that come with the use of this technology?
Yes, I very much agree with it. I think you have to, if this is a subject you deal with regularly, you have to be schizophrenic. I'm delighted about so many things that are happening now in medicine and logistics and education all around the world, that AI is improving the entire quality of life and food production. And at the same time, I'm very, very scared, as most AI people are too. And when I wrote my book, my publisher said, Jay, put in something positive. You have to have at the end of the book a solution to all this mess because it's really difficult. And the best I could come up with were the nuclear scientists who created the atomic bomb. And when they were doing their research, they had no idea until Nagasaki and Hiroshima. And then they realized what they had created. And then they went about creating the Union of Concerned Scientists and many other groups, which later built the foundation for disarmament. So it was the people inside the industry who were most capable of it. And I talked to the AI people all around the world, the serious people, the top people, and they all say they're scared, and we are working on solutions.
All right. So, Jay, you say that it's, of course, important to acknowledge the good aspects of it as well, how this is helping in medicine and education and so many other fields, agriculture you mentioned. Let's talk about this pandemic and the role of artificial intelligence, how it has been throughout this time. Do you think it was unprecedented and groundbreaking?
For one, most people don't realize it, but artificial intelligence discovered the pandemic. They didn't discover the first cases of the disease. That was in October and November when strange unknown lung diseases were appearing. But it was a Canadian company that discovered that this is a pandemic, and the way it's spreading is dangerous for us. And the statistics we use every day, the tools of our politicians when they make their decisions, what to shut down, open the schools, let people travel, let them not to. Most of these decisions are made with the assistance of artificial intelligence. It would be impossible to imagine that. And at the same time, it's critical in the development of vaccines and treatments, because medical research today is very, very, very much dependent on artificial intelligence.
Right. I'm going to take the same question to you, but change it up a bit and ask you, for you, what do you think is the most positive highlight of how fast we're moving in trying to integrate AI into various sectors of our lives?
I have been doing a tremendous amount of research into how are we going to feed a global population that's going to exceed 9.5 billion people within the next 30 years. And it's clear from the pressures that are being put on agriculture around the world to grow more food, but keep it within the same environmental footprint. And many people are saying stay away from genetically modified organisms. That's a whole other issue. But when you take a look at the changes in technology and in the growing of food on farms of consequence, you cannot do it without highly sophisticated technology. And this is where AI is playing a very positive role. You take a look at the way that farmers now are expanding the yield that they develop on their fields using remote sensing, precision irrigation, watering, and nutritional delivery across sort of vast areas of space. It cannot be done without the benefit of machine learning that is learning exactly what's happening in that soil in a particular place. So when I see this and when I see what farmers and the entire ag sector are starting to introduce, I go, that's a positive use because we all need nutrition.
Right, right. Such an important point you raised there, something that really leaves us to think about how innovation can help our modern day challenges. Now, one thing that I just want to bring about here, and I'm going to shift gears a little, but I think it's important to talk about because it's such a hot topic. It's about deep fakes, how that's being used and the threats of that, because this is raising a lot of concern all over the world. Stuart, let me go with you first.
Well, my main concern about it is the inability of the technology right now to deliver with accuracy, and so it is creating a body of information that is used to make decisions about individuals. That when we come back to your original question of how does this compromise our rights and freedoms? Well, this is where there is a compromise because you are no longer dealing with another human being that you can reason with, that you can explain to. There's an algorithm that is now starting to make decisions about you and the kind of person you are, what your motivations are, and it then directs people to make decisions that can incarcerate you, could bring about a tremendous amount of harm to individuals. That's
right.
My big concern.
Right. Mr. Jaitak, that same point there, deepfakes, we're hearing so much about it, and it's really all the rage on the internet, on social media these days, how forged images are being used, how they can be used to blackmail people, create more misinformation. With all of this happening, do deepfakes have any pluses with them, or is it all negative and bad?
Well, I know Facebook and many of the other major players, Google and so on, are using AI to fish out the fake news, to help find it. And the only way you can do that is if you can crunch the size of numbers that are involved in the internet today, and they're huge. So it can be a tool that can be used in both directions. It's dangerous if you're able to create false people, or in a dialogue you think you're talking to a person and you're not, you're talking to a machine. But it also has its advantages as a tool to keep us honest.
Okay, so Jay,
after the next section, a little more.
Right. Jay, I'm just going to end the segment with a question that you kind of raised earlier yourself, a statement more so, which is that the lawmakers don't really understand what's happening here. So how do we update laws and regulations if the people responsible for creating them don't really understand this technology?
Well, in elected governments, and those are the ones we're talking about in democracies, each and every one of us has a responsibility to make sure that our lawmakers are on their toes and are paying attention. So I think each of us in a democratic society has a responsibility to think about and study what AI is doing in our society, because AI is assuming more and more and more responsibility every day, because it's very, very good at what it does. And if we don't, once we've given up our responsibility for an area of our society, a decision-making area, it will never come back to us. It'll be gone.
Right. Stuart, just your last thoughts very quickly on that same point. How do we make sure that laws and regulations are kept up to date with this technology, with all the advances that are happening in society?
I don't think laws and regulations can keep up to date. They are always going to be lagging behind. And this is a big concern because lawmakers are not at the leading edge of this development. They're always in a position where they're responding. They are not leading. And this is why I think we need to be concerned, because staying on top of it from a legal perspective, late to the game. It takes a certain amount of integrity. So everything comes back to what's the intent of the programmer? What is their intent? What's their motivation?
Right. So much more to discuss when it comes to artificial intelligence. We've just been scratching the surface at this point. But thank you so much, Mr. Stuart McNish, for joining us from Vancouver, Mr. Jaitak for joining us from Hamburg. We're going to go for a short break, but when we come back, we take a look at the role of technology during this pandemic. Stay with us. Welcome back to the show. As unprecedented the challenges of this pandemic are, so is the use of technology during it. Finding new ways to contain the pandemic, technology is being used in healthcare, in the essential steps of tracing and tracking infected individuals, and much more. But it has also been used in rather insidious ways. We're going to discuss that and more. Joining us for this conversation today is Dr. Deng, who's the co-founder of Beijing RX Thinking Inc., which applies cutting-edge technology to solve healthcare problems. His company was awarded as the top 10 best practices of AI medical solutions by the China Academy of Information and Communications Technology in April 2020. He joins us from Beijing. Also joining us today is Usama Khilji, who's the director of Bolobhi, a Pakistan-based advocacy policy and research organization focusing on digital rights and freedom of expression, and is on the advisory board of the London-based Refugee Rights Europe. He joins us from Islamabad. Thank you both for joining us, and a very, very warm welcome to the show. Usama, let me take the first question to you and talk to you about the most essential steps that all experts have deemed necessary for fighting this virus, which is test, trace, and quarantine. And that big part of it, tracing and tracking those individuals, is very essential. How have you seen technology all across the world, but especially in this part of the world, being used to do this?
Oh, no, I was just getting into that. So what we've seen governments do is rely on technology around the world, and especially for contact tracing. But when we talk about Pakistan and more developing countries, I think it's important to keep in mind that the technology advancement and also the penetration of technology. So how many people really use smartphones or are connected to mobile phones. And then secondly, a lot of these tracking apps, use either Bluetooth technology or GPS technology. So if you don't have a smartphone, you're only left with location tracking through SIM cards and through your cell phone towers. And I think with that come issues of accuracy. So we've seen the Pakistani government set up, tracking systems. They introduced some applications, and then they were also using mobile phone technology or self-site information. But I think the issue with that a lot of times is, like I mentioned, is that of individual privacy, and then but also importantly whether or not that is really effective in terms of being accurate in tracking the location of the contacts that you're trying to track.
Right, those are all very important points, and I'm going to come back to them. But Dr. Deng, you are working with technology in a completely different field. Tell us how your company has been doing that, and this point about accuracy and trying to question that during this time. How do you try to deal with that question in your line of work?
For this very difficult time, so our company focusing on how can we do the data mining from humongous amount of the medical records. Especially we do something called telemedicine, meaning that the patient is not exactly in the hospital. How can we do the diagnosis and give the recipes over the internet? This is what we're doing over there.
Right. Why was this necessary, and was this happening, and to what scale was this happening prior to the pandemic?
Yes, that's very interesting and very important, because especially we don't want a lot of people walking on the street, walking through the subway or the bus, because that is very dangerous for people to express all this virus. We want people to stay at home as much as possible, so that if not urgent, not exactly necessary, we do a lot of diagnosis and therapies online. So that is very effective.
How do you measure that efficacy? Because that's a point that Usama brought, of course, from a completely different perspective. But I think it's really essential to raise that point when we're talking about how technology has been dealing with this pandemic. Yes, we've been integrating that, but how do we measure how effective it has been?
So we have basically three numbers to measure. Number one is that how many people get infected. As we understand and as we observe that once people stay at home, don't go to street quite often, the number of infected people will be dropped immediately by a very large percentage. That's number one thing. The second thing is that how many drugs, all these meta things we are using for in term of economic measurement.
Right.
So we also notice that once people stay at home, the cost of the social medical expense will drop, effectively. The third one is that for industry, education, or other things, because people staying at home, sometimes we may think that the output of this factory will be dropped immediately. However, we also notice that some company like us doing the software, it doesn't drop too much. People can stay at home. We talk to each other online. We have a video conference. We do the programming,
right.
And then we do the diagnosis if you don't feel very good.
Right. Dr. Deng, I'm going to come back to all the work you're doing. It's very, very interesting. Usama, I want to jump back to you and talk to you about this point that you raised earlier. We need to keep the accuracy of all this in mind. How much is it really helping these infrastructures, these systems we're creating right now that will be here to stay, because it's all a part of creating a robust pandemic preparedness system within our countries? How do we measure that in such changing circumstances?
That's a good question. So, first of all, I think a lot of your contact tracing is very dependent on your testing capabilities. And if you're not testing enough, you don't really know who's infected. And if you don't know who's infected, how will you trace them, right? So because in Pakistan, we saw that testing numbers were very low as compared to the total population. So even right now, we have around 220 million people, but per day tests are around 20,000, right? So that's a very tiny proportion of the total population that is being tested. And although now we've reached a time where, the virus is pretty much subsiding, hopefully, but at the same time, the question remains that if you have not done enough tests, you can't really be doing effective contact tracing.
Right.
But as far as your question about whether these systems are going to stay or not, it's a very important question, and I think it's important for the state to really learn, from this whole project and then keep those expertise in mind for another pandemic. But what's very important is for them to treat these measures as emergency measures and only use them during the time of the pandemic. Because what's happening is that a lot of our health data, our personal data, our location data, which is very private and critical information, is being shared with our consent, but most of the times without our consent.
Right.
And if, say the pandemic is over, should the state authorities still have access to very personal, private location data of ours? And secondly, in place of, there are no data protection laws present in Pakistan right now. So when you do not have legal cover for such data, then it becomes all the more problematic because this data is open to abuse. So what we've recommended, and there has been a Pakistani data protection law draft that was floated earlier this year, and what we recommended is that there should be sunset clauses for privacy and data protection during the time of the pandemic. And we understand it's a time of emergency where we need to have the greater breach of privacy in order to carry out this surveillance. But at the same time, we say that a lot of that information should be aggregated and it should be anonymized so that individuals cannot be tracked individually and separately, but there are ways of tracking, movements of populations through cell phone location data, as well as applications, while protecting the right to privacy of the individual.
Right, Usama, what you're hearing is that we need to make these systems more efficient, and that point that I said, that they shouldn't become insidious and these systems shouldn't be used in an underhanded manner in which civilians aren't even aware to it. I know I just have you for a short bit. I just want to put this one question to you, which I think is very important from a common person's perspective, someone who's not that engaged with technology, which is, doesn't the government already have all our data? So what does it matter if during this time they're collecting more of it? I mean, what else do they have to know about us? And this isn't just something Pakistan-centric. This is something that individuals all across the world voice. So you as a data rights expert and an activist, how do you see this?
I think yes, the state does have a lot of data on us, and I think it's all the more important for there to be protection of this data, for there to be, there should be laws that really protect our privacy, especially data that's held by the government. So for example, in Pakistan, we've seen NADRA, which is the main database of citizen information, being hacked a few times. At the same time, the Punjab IT board was hacked a few times, in which data of a lot of citizens was leaked and even sold in the black for all we know. So are there any legal protection against that? And as we move towards digitization and a more robust digital economy, we need to be talking about data protection increasingly. We need to have more control over the data that we give up to states as well as companies, and we should have the option of getting that data back and removing our data from them also, because we've seen this data being misused multiple times in very different contexts. Hence, a need for a robust data protection and privacy law in which us, the rightful owners of this data, take back control over it.
Right. Thank you so much, Khilji, for joining us, talking to us about this. This is so important, how the collection of data, of course, means that there is more data available to be vulnerable, more data available which can be exposed, and therefore these data protection laws are more and more important. Such an essential point. Dr. Deng, to that very point, how does your firm and how do all the firms that are dealing with sensitive data ensure that it isn't leaked, it isn't hacked? What really is happening on that front? Because we know that China is one of the most advanced countries when it comes to investing in AI, and therefore there's a lot of data that can be misused.
There are 2 points over there. For our company, that's a very simple problem. We are constructors. We are not the owner of all those data sets, meaning that we are asked to do the data process. But how can we use that? We don't have this authority. So that means we don't have to worry about this one. We're just a constructor. You give the blueprint, we build up the building for you. The second point is that for the whole country-wise, how can we use all this data to improve the security? Not only for the medical security, but also for the criminal security. And how can we get the balance between the security versus the personal privacy? That is a bigger social issues. So essentially, we have 2 arguments over there in China, very interesting. Number one thing is that all those data, especially like the camera data, all those sensor data, are collected in the public area, like a street, like the subway. So one argument is that once a person walking on the street or in the subway, it means that the ownership of this his personal data is not his personal ones. It actually belongs to the public. That is one of the argument. The second one is that how can we get the balance, especially during the time of this pandemic? A lot of people arguing that everybody who should be responsible for the whole social, healthiness should somehow sacrifice their privacies.
To what extent? To what end? Because this is a point I want to ask. This is essential in the Human Rights Declaration, which is that an individual is entitled to their privacy. I know what you're saying here. I understand. I hear you that in emergency situations, there have been unprecedented moves. But when we're talking about what's happening, how do human rights, human freedoms fit into this conversation from your perspective?
So the very interesting point is that how can we draw the line between these 2 extremes? One is the security, social security. The second part is the personal privacies. It's really hard. It's really hard to draw this line. So I'll give you one example. Last week we have a very beautiful city called Suzhou. Very big city, is close to Shanghai. They gave a certain things called a civilization card, meaning just like Germany, they gave every people over there a credit, meaning that you have a good behavior or what. So you give a score, and the score go with you all the time. And this week, the city decided to drop it off because a lot of people complaining that this is somehow intrude everybody's privacies. So it's really hard to draw this line. This is the first one. The second one is that for some circumstance, like in China, you can walk on street. No worry, you walk on street even like 3 a.m., the most dangerous time in Beijing, in Shanghai, all those Chinese city. But it's not very possible if you're doing such kind of thing in New York City. That is too dangerous. So another argument is that how can we draw different lines in different time zone, time spot, also in different area, like in those dangerous area, in those dangerous time,
Dr. Kandeng, I'm going to have to hold on to that. I'm going to have to hold you on to all those interesting points you're making, but I have to also introduce another guest who's joined us, Mr. Pierluigi Paganini. He's a cybersecurity expert. He joins us from Rome. Thank you so much, Mr. Paganini, for joining us. Welcome to this show. Now, let me take this question to you that I took to Dr. Kandeng earlier as well. When we have more data, it becomes more exposed to cybersecurity threats. Have we seen that happening during this pandemic?
You are right. In this specific period, people are more exposed to cyber threats because they are working from home, or simply because their online presence is increased due to their research for information about the pandemic. We have observed an impressive number of coronavirus-timed attacks aimed at citizens worldwide. Most common attacks are spam messages posing as healthcare information, healthcare organization, and government offices. We have observed millions of malicious email sent to the users. Thousands of malicious domains were created every day to be used in phishing attacks or to deliver any kind of malware. So one of the most interesting attacks we have observed employed fake contact tracing application that promise, for example, to locate positive individuals near the victims, but they install a malicious code on the victim device instead.
Right. In fact, to that point, the World Health Organization released a statement in which it said, beware of criminals pretending to be the World Health Organization. Hackers and cyber scammers are taking advantage of the coronavirus disease pandemic by sending fraudulent email and WhatsApp messages that attempt to trick you into clicking on malicious links or opening attachments. There seemed to be a war on two fronts. While there was a pandemic that was raging, there was also a pandemic of misinformation. How, from your lens, can this be addressed in the future in terms of the lessons we've learned from what happened now?
One of the most important aspects is the information sharing. It is essential for governments to share information about cyber threats, threat actors, and also ongoing attacks. This could help governments' incident response teams to adopt the right strategy, the right defense strategy, to try and to transfer the necessary information and recommendation to the organization in their countries. From the end user perspective, it is important only to refer trusted sources to keep the system up to date, to install any kind of defense solution, avoid opening any unsolicited messages coming from untrusted sources, and let me also suggest to install only necessary application on their mobile devices.
Right. Mr. King, let me take this question to you. We've been talking about the role of technology during this time. I want to ask you this important question, which is, of course, I put this to Mr. Paganini earlier on as well, but what are the lessons to be learned of how we integrate technology during a crisis like this? Because we know from experts, from health experts all across the world, that this won't be the last pandemic. In fact, they will become more frequent in the future. So given that, how do we learn on how we integrate technology in medicine, in various other sectors?
So that's very good. In China, we basically do three things. Number one thing is that we call something called a cabin hospital, meaning that if the pandemic occurs again, we can construct many hospitals in a very short time, like 1 week or 2 weeks. So like our company, we contribute all those cabin hospitals. We're doing the AI doctors. So once we receive this requirement, and from the requirement to the product online, we only cost us like 5 days, very quick. So we put all those things into the carrier, the carrier, like the big box. The big box is just like a moving mobile house. We put all this equipment inside it, and we wired all this network stuff, and then we ship to the spots. And we hook up the electricity, power, networking, water, done. So that's really quick. That's called a facility, the number one thing. The second thing is that we have a large training and online diagnosis system. The purpose of the second goal is that we can have a very large doctors in a very short time. So that is something prepared for like a crisis. So meaning that in 2 or 3 months, we can train 10,000 or 20,000 doctors in 2 or 3 months. That is a personal training, the second thing. The third one is that we call something like, we call it the grid control, grid management of this public health, meaning that we have all those records for almost every patient in the history. Before that, all those patient medical records are scattered, are stored in every different hospitals. Nowadays, we push very aggressively, saying that we unite all those medical records from all different hospitals, so that if you search for one patient's medical record, you can see all his record, historical one, from all different hospitals.
Right.
That will give a very, integral profile all these peoples.
Right.
So that is called a great health care management system. 3 points.
Right. 2 very important points indeed. Mr. Paganini, I'm going to take this last question to you. From your lens, from your expertise, when we see the role technology has played during this pandemic, in certain ways it caused more cyber attacks, but in many other ways it helped curtail the spread of this outbreak. What are the important lessons that you take away from this? I know it's an evolving situation, but seeing how technology played a role, what do you think for you has been the important aspect for it, and what important lesson do you take away from it?
As I told you before, the most important aspect is that we need more collaboration between the public and private industries. This means that we need more collaboration among governments. It's essential, the collaboration among governments. And when I speak about collaboration, I'm extending the concept not only to European members, but to governments worldwide. We are all in a global environment that we call cyberspace, and any kind of attacks could be moved in any time, in any place, from everywhere. So it's important to share information about the attacks in order to prevent this kind of situation in the future. I believe that the most important aspect is the information sharing.
Right, information sharing. We need to work on that cooperation, and I think this pandemic is what really highlighted how important cooperation and coordination in a more globalized world is. In fact, made the fault lines in our cooperation, in our coordination, the lack of it more evident, and how that has had devastating impacts. Thank you so much, Mr. Pierluigi Paganini, for joining us from Rome, Dr. Deng for joining us from Beijing. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.